Welcome to this brief tutorial. It is presented to you from the Public Health Centers for Excellence and provides an overview on community health assessments. In the next few minutes, we will cover what a community health assessment is, why we do one, when they get started, how the work gets done, the steps to take in a typical assessment process. We will learn about important considerations for success, have a quick quiz, and end with a list of resources. What is a community health assessment? A community health assessment is the data collection and analysis that often creates a document or a product. This module will cover this aspect of a community health assessment. A community health assessment process is the systematic, comprehensive collection, analysis, and sharing of information about public health issues and the health status of the population, identifying and prioritizing health issues, and developing recommendations for public health action using stakeholder input. For more information about the process, please check out the module, Community Health Assessment Process, 6 Common Phases. Why do a community health assessment? We often think we know what is happening in the community, or we have stories about individuals, but having concrete data to describe the issues in a community is key. It gives a better picture of your community's health. There are many reasons for doing a community health assessment. Here are just some of them. When do assessments get started? A topic for a community health assessment gets selected in many different ways. As you or other staff are out in a community, you may hear repeatedly about an issue. The theme becomes an idea for a community health assessment. For example, mental health could be a theme being discussed in many sectors in a community. Internally, program staff may ask if an assessment can be done about a specific topic. It may be a simple assessment or a deep dive into a larger issue. For example, firearm safety or overall injury prevention. After conducting an assessment on a population, staff sometimes have identified additional issues to look at. For example, from a maternal and child health assessment, maternal smoking could come out as a priority issue. Staff may need to assess this area even further. And then periodically, public health and others need to conduct a comprehensive assessment looking at the community's health to determine priority health issues. We then look at all determinants of health, so we can choose together some key issues we want to improve. This comprehensive community health assessment is a requirement for public health to apply for national accreditation. How does the work get done? Public health staffs assessment work in a variety of ways. Some agencies have dedicated assessment staff funded by general, non-categorical funds. The staff are dedicated to assessment work. Staff could be funded by categorical sources like state tobacco or maternal and child health funds. Some agencies contract with outside consultants and purchase the service. If located by universities, agencies can use their student interns or professors. Other agencies may be willing to provide needed services, like county agencies often have mapping resources. Shared staff models have worked with public health, splitting staff time with the hospitals or other agencies. Local and state public health agencies that have assessment capacity can sometimes support those that don't have assessment staff. There may be other models that can be used to get the work done. Staff who conduct community health assessments and facilitate the process need a variety of skills. The process of conducting a community health assessment requires more than just compiling and analyzing data, but also skills like project management and presentation skills. You may need to bring in several staff from different disciplines to meet all of these competencies. Here are some general steps to gathering data and developing your report. Decide on what indicators or data you want to use. Find where you can get that data. Possibly collect data that is missing or unavailable through focus groups or interviews of key people in your community, or gather data through a survey. Then compile your data, looking at it in different ways, such as by age or male-female. Then put your report together, highlighting the key points. If your agency does not have epidemiologists or statisticians on staff that can gain access to the actual databases, there are data clearinghouses and resources available. I will describe the resources that Washington has, which may be available in other states too. Here are just 3 examples of some reports that were put together by Spokane Regional Health District staff. These are some of the most common data sources used by public health assessment staff. The Washington State Department of Health website provides access to a lot of these data sources, as I will show you on the next slide. To understand each of these data sources, you will need to take some time exploring the links on their website. The Washington State Department of Health provides a clearinghouse on their website that includes guidelines, access to queryable databases, pre-prepared reports at the county level, tools like chat that staff can use to run their own data, and an indicator site that has already selected measures and posted data at the county level in comparison to the state. Some considerations on presenting the data. Often I hear questions like, why put it in a document? Does it have to be fancy? How technical should it be? Or what should it include? The report documents what data was analyzed and helps you share the process and findings. You can use the report over and over for reference. An assessment shouldn't end with the report, but used to take action. You can pull data from the report for grants, fact sheets, media requests, and for educating others on community issues. So those are just some of the reasons of why we put it into a document. Reports can be completed in different formats for different purposes. 1 to 4 page fact sheets, white papers, full booklets. It can be in a simple Word document or put into a graphic software with lots of photos. Depending on your audience for the report, it may be more or less technical. Comprehensive community health assessments often include, in addition to your indicators, geographic information, demographic information, socioeconomic factors like education and income, qualitative information from your focus groups or interviews, a summary of significant findings, and possibly recommendations of how to take action on the key points in the report. It's important to present the data in a way that is understandable and won't be misinterpreted. Assessment staff often are asked to explain why a rate is higher than another or why they think the trend is improving. These are complex questions and can't be answered easily. The answer to why usually comes from further study or conversations with your community members. So let's test your knowledge. What are some reasons for conducting a community health assessment? You may have said things like to quantify a problem, maybe to describe the population most at risk. You may have said to use data in a grant or funding proposal, or to create awareness of issues in the community, or you may have said a lot of other reasons. Here are some excellent resources for conducting a community health assessment. There are also modules on the full community health assessment process and one specifically on how to develop a CHIP or Community Health Improvement Plan. We look forward to hearing from you if you would like further technical assistance on this or other performance management topics. This presentation is part of a performance management and public health training series presented by Washington's Public Health Centers for Excellence and funded by a grant from the Centers for Disease Control and Prevention. The centers are located in the Spokane Regional Health District and the Tacoma-Pierce County Health Department. Our goals are to help local health jurisdictions and tribal agencies improve their results, prepare to meet public health standards, and achieve accreditation. In addition to this training series, we offer technical assistance and resources in performance management to improve public health outcomes. If you would like to talk with us about how we might assist your organization, the contact information is on the preceding slide.